Hello, everyone, and welcome to the second week of Zoom webinars on respiratory diseases in small flocks. Today, we'll focus on avian influenza and Newcastle disease. Just a little bit about myself before we get started. I am currently a fourth-year Doctor of Veterinary Medicine student at the University of Minnesota. Before vet school, I completed my undergraduate work in animal science, also at the University of Minnesota. I grew up on a small hobby farm in southern Minnesota where we raised chickens, ducks, geese, turkeys, and guinea fowl for fun, food, and 4-H. I've done quite a bit of work with larger poultry farms, but my first love will always be backyard and small flocks, so I'm excited to be here with you all today. A quick disclaimer, these webinars are for educational purposes only. We will not diagnose any disease or prescribe any treatment for individual birds or flocks. Please contact your veterinarian for questions on specific disease diagnosis and treatment. So we will start off with avian influenza, and we will focus on what it is, how your flock could potentially get it, what it looks like in a flock of birds, and what you should do should you suspect it. Some quick history. Outbreaks caused by avian influenza viruses, including both highly pathogenic and low pathogenic avian influenza, have occurred in United States poultry from time to time. One of the most recent and largest outbreaks, which I'm sure many of you remember, was a high-path avian influenza virus was detected in 21 states from December 2014 to the middle of June 2015. And this affected 211 commercial flocks and 21 backyard flocks. Some other sort of recent outbreaks in the United States include January 2016, there was high path and low path viruses that were reported in Indiana. And then in March 2017, high path and low path viruses were reported in Tennessee, and then they subsequently spread to Alabama, Kentucky, and Georgia. So just focusing in on Minnesota for the 2014-2015 high path outbreak, more than 4.8 million turkeys and 4.2 million layers on 110 farm sites in 23 counties were affected. Most of the farms were turkey farms, 5 of them were egg layer farms, and 1 was a backyard flock. It wasn't identified in any Minnesota game birds or broilers, but the fact that 1 backyard flock was affected just kind of shows the importance of learning about these diseases and knowing what the clinical signs are and how you can prevent them. So what is avian influenza? Avian influenza is a virus. It's an influenza A virus, to be specific, and it has several subtypes that exist, and these are based on the relationship of the virus's proteins. So these proteins, hemagglutinin and neuraminidase, that's where the H and the N come from, they're basically used by the virus to enter the bird or whatever host they're going to enter. And then the ability to cause disease is based on the combination of H and N proteins from the virus. So, for example, the combination of H5N1 proteins means that it can be highly pathogenic. So as I said, avian influenza viruses are based on the proteins, and then from those combination of H and N proteins, they can be classified as either highly pathogenic or low pathogenic. So low pathogenic is a much milder disease. Clinical signs are usually much less apparent or even absent, and mortality is low or again, even absent. Sometimes other infections or if the virus is circulating for a long time, it may cause low path avian influenza to mutate to a highly pathogenic form, and then this would lead to more serious disease. So highly pathogenic avian influenza, or high path AI, causes sudden mortality as high as 100% in flocks. And the viruses of the H5 and H7 subtypes are the most common to cause high path avian influenza. How does my flock then get avian influenza? So avian influenza is a virus that can affect all domestic poultry. This includes chickens, turkeys, pheasants, quail, ducks, and geese. However, waterfowl are natural hosts, and They usually don't show clinical signs, but they can spread the infection. So, especially wild waterfowl and shorebirds, they are, like I said, natural hosts, and they don't show those clinical signs, and they can spread that infection to your birds. Um, Once the virus is in a flock, then it's usually spread to other flocks via clothing, boots, and equipment. So, what does it look like in a flock? So, it can be any combination of what I have listed here, or it could just be one of these things. Sudden death of more than one bird, respiratory difficulty, so gasping for air, coughing, nasal discharge, some of the things that were talked about in the first webinar. Watery or green diarrhea, decreased egg production, swelling around the head, neck, and eyes, and purple discoloration on the head and legs may occur. So here's just some pictures to go with the last slide. So this first picture is some of that green watery diarrhea. Second picture, this bird just looks a little lethargic. It's got some ruffled feathers. It's got a hunched appearance. The wings are a little droopy, and it has some of that diarrhea. The next picture, this bird again has ruffled feather appearance. You can see the purple and blue discoloration of the comb and wattles. And in this middle picture down below, you can see that much better, that purple blue discoloration. It looks pretty swollen. This first picture here is the underside of a bird looking at the wattles, and you can see just how swollen that is. And then this last picture here is just some of that purple and blue discoloration on the legs. So additional problems are usually neurologic in nature. So those would include tremors or shaking, twisted necks, paralyzed wings, and then laying down either on their side or on their back, and they're paddling or pedaling. So if your flock has sudden high death rates, or there are many birds in your flock that have one or more of the symptoms that we just talked about, contact your veterinarian and or the Minnesota Board of Animal Health as soon as possible. Remember that it's infectious and that it can spread easily to other flocks. So you need to quarantine your flock. Don't let anyone who has birds at home come over and visit. And then you yourself keep away from other flocks. So don't go visit your neighbor that has birds. Just keep your distance. And antibiotics can be used to treat secondary bacterial infections, but avian influenza itself is a virus. So antibiotics are not going to treat it. But this would be something that you could talk with your veterinarian about and ask if they think that there could be a secondary bacterial infection in addition to the avian influenza, and you could talk about antibiotic treatment options for that. So prevention is key with avian influenza, as there's no treatment, and unfortunately vaccination is not currently allowed due to restrictions that it would put on exporting poultry products, so meat and eggs. And then stay tuned for our February webinar, where we are going to dive into biosecurity and how you can protect your flock. Up next, we'll talk about Newcastle disease. And again, it's going to sound very familiar. Not everything, but most things are very similar. We'll talk about what it is, how your flock could potentially get it, what it looks like in a flock. And you will notice that the clinical signs, like I said, are very similar. And I don't want you, the goal of this is to not have you be able to differentiate avian influenza from Newcastle disease, but just to recognize what respiratory disease looks like in your flock. And then again, we will talk about what you should do should you suspect it in your flock. So just a little bit of history. Virulent Newcastle disease has been detected before in the United States. Actually, recently, between May 2018 and 2020, the USDA confirmed 476 positive cases in California. 4 of those sites were commercial flocks, and then the rest were backyard flocks. The USDA also confirmed 1 infected site in Utah and 1 in Arizona, and both of those were linked with birds that were moved from California. Other major outbreaks have occurred in 1971 and then again in 2002, 2003. And the source of those outbreaks were tracked back to illegally imported fighting birds from Mexico. Pet birds are also, like parrots and other citizen birds, are also known to be carriers of the disease and have caused disease in poultry. So what is Newcastle disease? It's a viral infection of domestic poultry and other bird species. Chickens are extremely susceptible. And again, just like avian influenza, waterfowl, so ducks and geese, they tend to be resistant, but they can also carry it and shed it. And then the citizen birds, like the parrots, they are susceptible. It can cause disease and death in them, but they can also carry it and shed it without any symptoms at all. So that's just something to think about if you have pet birds and backyard chickens, just to be aware of. So there are 3 forms of Newcastle disease, and whatever form is present kind of depends on what sort of symptoms and signs you'll be seeing in your flock. So lentogenic Newcastle disease is basically the mild form. You'll see some mild respiratory signs, maybe some neurologic signs, probably not. There'll be some decreased egg production and eggshell quality issues. It's usually pretty widespread in the United States, but it rarely causes disease outbreaks. And it can affect all ages of birds, but again, it just often goes unnoticed. The mesogenic Newcastle disease is kind of the middle. It's the most common type in the United States. It is known to cause respiratory and neurologic signs in young birds, but usually not adult birds, older birds. And then there's the velogenic or the virulent Newcastle disease, which is what we just talked about in California. It's highly pathogenic. It causes acute, sudden death. And this is a form where we do see the nervous system issues and extreme respiratory issues. So how does my flock get Newcastle disease? So Newcastle is spread from an infected bird. It can be either from respiratory secretions or excreted in the feces, and it's very easily spread and it's very highly contagious. Waterfowl, ducks, and geese, and like I said, pet birds, especially the parrots, are able to infect other birds without showing symptoms themselves. Again, contaminated footwear, clothing, and equipment is another way that Newcastle disease can spread, and especially spread from to an uninfected flock from an infected flock. The virus is very hardy and it can easily survive on people's hands, clothing, and footwear for long periods of time. And it can also survive in the environment for several weeks or more. And it can especially do that in cold weather. So what does it look like? Kind of like avian influenza. You'll see respiratory difficulty, gasping for air, coughing, nasal discharge, some nervous disorders like tremors, twisted necks, paralysis, circling, the paddling of the feet, decreased egg production, and some eggshell quality issues. Some additional signs would be sudden death of more than one bird, droopy wings, watery or green diarrhea, loss of appetite, muscle spasms, and depression. So here's just some pictures. This top picture, you can see some discharge coming out of the eyes. There's probably some nasal discharge as well. This next picture is again the green watery diarrhea. And then here we have a bird who has a twisted neck. I'm sure there's some paralysis going on as well. The bottom pictures show some egg quality issues. So the picture on the left, the egg on the left is a normal egg. And then the egg on the right should look like the egg on the left, but it's lost pigment. The color of its shell is absent. And then this picture on the right here, you can see a bunch of cracks, just really thin eggshells. So if your flock has sudden high death rates or any of the signs that we talked about, you should contact your veterinarian and/or the Minnesota Board of Animal Health as soon as possible. Again, highly contagious, so you need to quarantine your flock and you need to stay away from other poultry flocks. So just like avian influenza, there is no treatment. Antibiotics are not going to work because it's a virus, but they may help alleviate some clinical signs if there is a secondary bacterial infection. So again, you need to talk to your veterinarian about this. And vaccination is an option. Chicks can be vaccinated at the hatchery for Newcastle disease and infectious bronchitis, which we'll talk about in the next webinar. And that's a combination vaccine. But if you purchase younger birds, pullets, or even mature birds, and you're just starting your flock, or you want to add to your vaccinated flock, you can vaccinate with a Newcastle Disease B1 vaccine. And you can do this through either the drinking water, you can do it intraocularly, so in the eye, or intranasally, so in the nose. And then after that's given, you wait about 4 weeks and you give a more reactive vaccine, which is called the Lesota Newcastle disease vaccine. The problem is that these vaccines do not protect against the velogenic or the virulent Newcastle disease. So again, biosecurity is super important. And again, we'll be discussing biosecurity in great detail in the future Zoom session. But one thing to note is that Newcastle disease is sensitive to most disinfectants, and that it can be inactivated by proper cleaning and disinfection. But you have to do the cleaning before you do the disinfection, because a lot of disinfectants do not work if there's organic material like feathers or feces. So you need to get rid of those before you use the disinfectant in order for it to work properly. So that's all I have. Just a reminder that there's some upcoming presentations. Next week, we'll be talking about infectious laryngotracheitis, infectious bronchitis, and mycoplasma. And then the next 2 weeks after that, we'll be looking at the veterinary diagnostic laboratory and what they can do for you and your flock, and then biosecurity. And those are Tuesdays at 4:30 Central Time. So we'll move over to the question and answer session, and I'd like to thank you for your attention.